it's Satoru here from Haruki Acupuncture and Herbs. In this video, I'd like to share with you how to use an oriental soup spoon called renge in Japanese to treat your trigger finger by yourself. The techniques I use with this spoon is similar to the techniques of Graston or gua sha in traditional Chinese medicine. These tools are used to break down scar tissue and adhesions in muscles, tendons, and ligament by scraping the affected area or skin. This helps to improve the range of motion, alleviate pain, and enhance the function of the fingers. When treating trigger finger, the typical options are getting corticosteroid injections or undergoing surgery to remove tissue. However, there's a non-invasive approach can also give you results that just as good, if not better, than those accepted treatments. There's a case study in which they used Graston techniques for unresolved right trigger thumb. They treated the patient 8 times, resulting in improved range of motion, reduction in pain, and better function. The patient reported personal satisfaction with this conservative approach. According to some research, corticosteroid injections can give you a relief for up to 3 months. However, some patients prefer not to go through surgery, even though it has a 91% success rate. For those who want to go the conservative, safe approach, and if you're one of them, you would try these techniques to improve your trigger finger all on your arm. Let me first clarify what the trigger finger is before I demonstrate this technique. Trigger finger, also known as stenosing tenosynovitis, is a medical condition that occurred when the finger flexor tendon and tendon sheaths become inflamed. This inflammation can cause a difficulty in straightening or bending the finger or locking in a bent position. While it's more common in women, anyone can be affected. This condition is also found in people who use their hands for repetitive gripping, typing, or playing an instrument like the guitar or piano. People with a medical condition such as diabetes or gout are also at higher risk of developing this condition. What kind of symptom do you get with trigger finger? There are 5 stages of signs and symptoms when the trigger finger occurs. Number 1, morning stiffness. During the early stage of the trigger finger, you may feel stiffness in your fingers, particularly in the morning. The sensation is often described as the hand needing to wake up, warm up, or getting the blood flowing. If you experience this, it could be the signs of trigger finger. Number 2, popping and clicking. Once you experience morning stiffness, you may soon notice that your fingers start pop or click when you move it. You might feel this sensation or even hear the sound as you move your finger. Number 3, a tender nodule at the base of your finger. If a loud sound is made with the finger, tenderness may arise at the base of your fingers along with a small bump or nodule. Number 4, catching and locking in a bent position. Suppose you experience clicking and popping sounds in your finger. In that case, you may notice that it starts to catch or lock in a bent position occasionally, making it hard to straighten up again. This occurs when a swollen tendon becomes trapped inside the tendon sheath and suddenly pops back into the place, causing sharp pain. Number 5, permanent deformity. In the final stage, the finger becomes immobilized for several hours and eventually days until it can no longer move at all. This usually happens when attempting to grasp something, and when the grip is released, the finger remains bent. Spoon techniques for trigger finger. Earlier, I mentioned that spoon techniques is quite similar to Graston technique or gua sha in traditional Chinese medicine. These 2 techniques use different shapes of tools. Graston used stainless steel instruments, while gua sha used jade, rose quartz, or metal. Both techniques aim to break down scar tissue and adhesions in the muscle, tendons, and ligament, or break up stagnant energy, or qi in Chinese, and promote the flow of the blood and lymph by scraping the affected area with these tools. The basic concept of both techniques is the same. They both work towards achieving the same goal. And you can also use a spoon to break down the scar tissue and stagnant qi and achieve similar result in releasing tension, reducing pain, and improving range of motion. Where can you find an Oriental soup spoon? You can purchase this type of spoon at the Asian grocery store or online for less than $10. This spoon has a various size and style, but I prefer the smoother edge because it's easier to scrape. Number 1. Spoon techniques on fingers. First, you apply massage cream or Vaseline or even olive oil to affected fingers. Let's see if you have a trigger finger and the middle fingers, and you can visualize the 3 lines around the finger. Hold the spoon upside down like this and use the edge. Press the edge to the joint and scrape along the lines. And please continue to scrape up and down for 30 seconds and move on to the next line and repeat this for 2 more times. Number 2. Spoon techniques on palm. There are 5 lines on the palm and extended from the wrist crease to the base of your fingers. Use a spoon to scrape each line from the wrist crease to the base of your fingers, up and down for 10 times before you move on to the next one. Continue 2 more times. Number 3. Spoon techniques on the base of your fingers. One of the root causes of trigger finger is often located at the base of your fingers where scar tissue tend to accumulate. To alleviate this issue, it's important to carefully break down any stagnant chi or tissue buildup in this area. There are tender spots between the joint of your fingers known as metacarpophalangeal joint. To massage this area, use spoon to apply pressure and rub up and down. However, be careful because this spot can be very sensitive and painful to touch if you have trigger fingers. If you find it too painful, don't worry, you can always skip this step. Please continue to rub each joint 30 seconds before you move on to the next one, and repeat this process 2 more times. Number 4. Spoon techniques on knuckles. In order to improve the flexibility of your fingers, it's essential to massage your knuckles. People with a trigger finger may have a sensitivity between their knuckles. It is important to break the scar tissue in this area. Place your spoon between your knuckles with your palm facing down and move up and down for 30 seconds, and you can repeat this process for each knuckles. And let's do this step 2 more times. Number 5. Spoon techniques on forearm. Now, I want you to imagine there are 3 lines on your forearm. To locate these 3 lines on your forearm, start from your elbow crease and move forward to your wrist crease. The line closest to your center is line 1, followed by line 2 in the middle and line 3 on your outside. Scrape along the line using the edge of your spoon 5 to 10 times up and down before you moving on to the next line. And you can repeat this process 2 more times. So after you finish these 5 steps of your spoon technique, I want you to use the heat therapy that aims to soften the affected tissue and increase the blood flow to heal quickly. A portable hand warmer is a convenient option for on-the-go use, but you can also use the heat pack and apply it to affected area for 20 minutes. I also suggest a neck wrap to alleviate tension in your neck. Tightness in your neck can hinder your process and make it difficult to proper blood flow to reach up your fingers. I recommend using a heat pack for around 20 minutes each day to facilitate the healing process. It can be beneficial to perform these techniques regularly as it may accelerate your healing process and eliminate the need for steroid injections or surgery. In case you are still experiencing difficulty straining your finger, you could consider seeking alternative treatments such as acupuncture before deciding on the surgery. If you or your loved one was diagnosed with trigger finger, please use these techniques. Hopefully, it helps you and your trigger fingers. Take care. Bye.